Of course, if you have questions, do start writing from the first only so that I get time to see the question and answer the question. Before that, I'll just tell you something about it is called as non-verbal communication. Means sometimes it is very difficult to interpret what the patient has told us in the whole case taking, and interpretations sometimes differ from doctor to doctor. So in this case, if you understand the meaning of non-verbal communication, that which can be seen by the patients, seen by the doctor, and remembered by the patients and the assistants and the associates very easily, that becomes a very important entry point of the case. For example, today I'll deal with perspiration, means pasina, perspiration. Now, you don't have to think whether you perspire or not. You don't have to imagine that you are perspiring more from the chest or from the forehead or from the cheeks or from the extremities. This can be remembered by the patient very, very easily and frequently also. Welcome, Dr. Abhishek. Good afternoon. For example, if you take a simple rubric, respiration in general, it is important to know because whenever the term perspiration or sweating comes, first remedy we think about is Moxol because that has been told and taught in our college days, and it's a very easy remedy to understand. But there are a lot of remedies which have perspiration, and that you have to understand that. For example, you can think about perspiration like you know veratrum or Muxol or phosphorus or Hipersulf, Natramur, Antimtar, China, Calcarea, Naxomica, Lycopodium, Silesia, veratrum. These have perspiration. But now, if the patient has a very important symptom of perspiration, and then you have to define that symptom. Yeah, welcome. Hello, Dr. Babal. You have to define that. For example, there is an important symptom or an important rubric called as perspiration one-sided. Sometimes it feels very difficult to understand whether this symptom will be there in the patient or not there in the patient. But believe me, I have seen a lot of cases where the patient says, sir, I only perspire on the right side and not on the left side, or vice versa. And I had I had a very interesting case of GERD, that is reflux disease, where the patient had a lump sensation in the throat. I had taken the whole case, but the patient was not improving, curatively. Then I entered the case where the symptom the patient told me perspiration was there only on the right side of the body. Of course, that was there previously also, but we did not take notice of that symptom. And believe me, when we took perspiration, especially on the right side or always on the right side, added few symptoms, and I gave the patient a single dose of bryonia. Bryonia, and bryonia treated and cured that case. This is the importance of non-verbal communications. I'll go one step ahead. Sometimes the patient comes and tells you, sir, sometimes the perspiration is on the right side, sometimes it is on the left side. Sometimes it is on the right side and sometimes it is on the left side. And then you get confused what to take. You can always take perspiration one-sided also, that is right, but we have an interesting symptom in Agaricus muscarius. Agaricus muscarius. That is perspiration alternating sides, sometimes on left side and sometimes on the right side. Now, if you see the rubric, perspiration left side we have Brata and Pulsatilla, I think, and perspiration right side we have Phosphorus, Pulsatilla, and Bryonia. This is the importance of understanding non-verbal communication. One example was perspiration. If you have any questions, you can start writing, otherwise I'll go ahead. Now, I had a very interesting case of arthritis. The patient had severe arthritis, especially of the left knee, and the patient had so much pain that the patient could not walk. The whole case was taken, and the patient told me a very, very interesting symptom, that I have perspiration and I have arthritis pain together. Meaning, I have pain in the left knee and I have perspiration also on the left knee itself. We again repetize the case, and I prescribe the patient the remedy Entim-Tart. You can believe Entim-Tart normally we prescribe mainly for that cough and rattling in the chest. Of course it is there, but if you see perspiration on the affected part, and the first remedy that comes to my mind is Entim-Tart, second is Rustox, third is I think Ambrosia, and then Muxol and other remedies also. But my point is that, have you ever prescribed Rustox on this symptom, that is perspiration on the affected part? My dear friends, perspiration on the affected part. Otherwise, it becomes very difficult to differentiate Rustox, Ruta, belly spur. Of course, you have that tearing pain and pain in the cartilage, pain in the bones, difficult to differentiate. But see how an easy symptom, perspiration of the affected part. That can be disease like arthritis, that could be migraine, that could be sciatica pain, that could be pain in the muscles, that could be pain in the teeth, and the patient comes and tells you that whatever side pains me, I have perspiration there. And this again is a very important symptom, perspiration of the affected parts. You can write down the most used remedy in my practice: Ambrosia, Entim-Tart, Rustox, Muxol, and then there is Guaiacum which I have used, and Strontium carb also. So I'll just finish. Welcome doctor. Good afternoon, Dr. Arora. I'll just take one question. Walaikum assalam, Wasim bhai. Case of delusion, mind feels like पैरों में पानी या खिंचान लग रहा है. See, पैरों में खिंचान. So you can always take the rubric pulling pain, and of course do rule out whether the patient is suffering from hypothyroidism, or the patient is suffering from low vitamin B12, or the patient is suffering from nutritional deficiency also. Then you can add to this symptom and go to the remedy. Please share your experience on chronic kidney failure, how we can go through the case. Yes, I think my fellow doctors who are working with me would be very happy so that I can answer this question, because we have lots of cases of renal failure and they are much better with our treatment. Where the creatine count, sometimes becomes 6, 8, 10. With our medicine, it comes down to 2, although the patient is taking medicine still. The patient on dialysis also we have, where we have stopped dialysis and the patient is again on homeopathic treatment. In kidney failure, I cannot tell that ask this symptom, or any case taking I cannot directly ask this symptom. But as I give exercise to my fellow doctors who are working with me, understanding the patient, understanding the syphilitic symptom, and then converting into a rubric form or the matermedica form. In chronic kidney disease, 3-4 symptoms, 3-4 entry points which I have found very useful in my practice. First is odor. Believe me, the patient has a lot of acuteness of odor. The patient says, please don't cook mutton gravy. I cannot bear it. The odor is so acute. We have remedies for acuteness of odor, that is syphilitic, out of control. You can sense the odor from a long distance also. We have Nux vomica, phosphorus, Lycopodium, sepia, Graphitis ignitia. Second, sometimes the opposite is there. There is no odor. The patient comes to me and says that today, very good food was put in front of me, but I could not smell anything. So odor diminished, exactly reverse of acuteness. We have calcarea, anacardium, natrium, hyoscyamus, sepia, silicea. First thing. Second, odor, and then we have taste. This is again a very, very interesting symptom. Sometimes the patient is not able to tell which type of taste. So don't feed symptoms in the patient's mind. Okay, he will tell you what you want to know. If you don't understand the taste, just take a rubric or a symptom altered taste. Then we can decide whether it is bitter, it is sweet, it is salty. Sometimes the patient is not able to understand and tell you a symptom. So altered taste, we have China, Rustox, Pulsatilla, Natramur, Viratrum, Lycopodium, Cuprum, whatever remedies I can remember. Two things. So these are syphilitic symptoms. Then you can have the patient understanding, tell that I have very bitter taste. In homeopathy, in India, we say like Karela, or the taste is so bad, before menses, or the taste is like banana, or the taste is lot of different taste. But altered taste, if the patient is not able to tell you, you can take that for prescription. Okay. Second thing. Third thing, try to find out why the patient has landed up in renal failure. Two causes are very, very important, either because of blood pressure or either because of diabetes mellitus. Be very sure that it is important to control blood pressure and sugar in order to get the creatine close to normal range, or in order to stop the dialysis. Whenever a patient comes to me, I do not stop his or her blood pressure medicines or diabetes medicines. I continue both. And then when the creatine starts coming down, when the patient, when the dialysis starts tapering, then gradually I assess the case and then decide what to do. Some are the patients who are with me are still taking the BP medicine and sugar medicines under control, and creatine from 8, 9 has come down below to 1.8 and 1.9. My fellow doctors who are working with me, they can also, they have also seen these type of cases. Regarding mind, of course, if the patient is young and renal failure, you have some symptoms like stress in career, stress in money, stress in the relationship, too much, out of control, syphilitic stress, syphilitic symptom in mind. If you can take, you can enter the case that also. Sometimes the patient comes to us and says, sir, I have absolutely anuria, I cannot pass the urine. Then I give some acute medicines frequently in repetition dose in LM potency, for example, L serum, and sometimes I give Punarnava, sometimes I give Bohriva diffusa, or sometimes also I can give the patient a dose of thalaspi, especially ladies having menstrual problem and anuria or urine problem. Then thalaspi also is an indicated remedy. Or the patient is suffering from recurrent urine infection, and because of that there is cystitis, and because of that there is marginal rise of creatine. Then you can think about turpentine, uva ursi, petroselenium. These are the remedies depending on the symptoms. Okay, but the crux of the case is you can always see the syphilitic symptom at either mind or the body. Okay. Sir, please suggest medicine for continued fever at night. Okay. Recently, just yesterday only, we had a case of diagnosed case was there. The case of leukemia. One of my assistant took the case. The patient has had the same history, fever since 1 month, not going down with any medicines. Then it was tested, and the patient had leukemia. I think she was a girl of 8 to 10 years of age. So whenever there is fever, and it is very easy to tell that in homeopathy we have remedies for continuous fever, but it is very important to diagnose also, which type of fever. You can always write pyrexia of unknown origin, but yesterday we had case, that's why it's very fresh in my mind, so I'm just sharing my experience with you. Now, continued fever, for example, continued fever is typhoid or typhus, So there are a lot of medicines for continued fever. For example, you can have sulfur, you can have merxol, you can have phosphorus, you can have stramonium, bryonia, arsenic, lot of remedies. So if you can give me other symptoms which basically are related, you can define the whole personality, it would be easy for me to give you the remedy precise. For example, fever continued. I had a case of a patient who had continuous fever and he was a drunkard, and I prescribed the patient hyoscyamus, and the patient was much better. For example, we have a continued fever and the patient says, my stomach is always bad, and whenever my stomach is bad, I have fever. I have fever since 12-15 days. My stomach is totally bad since 12-15 days. So you have a very interesting rubric and a symptom in a remedy. For example, continuous fever with gastric symptoms. Of course, you have remedies like pulsatile and naxonic also, but that case I remember very precisely. I had given that patient hydrastis. If you see hydrastis, continued fever of gastric origin, hydrastis is a very important remedy. Of course, in homeopathy, pulsatile is there, naxonic is there, carboys will be there, but I had treated that case with hydrastis with very good results. Okay, of course, there are other symptoms also which I took for prescription. So, continued fever, if you could tell me some more symptom who had asked me, I'll be very happy to answer that question. And whenever you feel that the question has been answered, just write something so that I can know that this question has been answered, so I don't need to repeat it. Okay, with coryza with fever, lycopodium did not relieve. Okay, so we have one more symptom, that fever which is continuous and which coryza. So see, in this case now the patient is telling you a symptom in relation to respiratory tract. Simple as that. First. And second, the patient tells you that because of coryza, she has fever and lycopodium has failed. I don't know which symptoms you took for lycopodium, but in this case, there are 3 remedies that comes to my mind. Very important, doctor. First, think about aurum triphyllum. That would, I think that would be sufficient for you to treat that case. Second, continued fever with coryza, do think about eucalyptus. I don't know how many of you must have taken eucalyptus for prescription. Eucalyptus, second symptom, second remedy. Of course, third remedy that everybody should think of and everybody knows in their practice is arsenic album. Of course, so I'll not tell that remedy. Fourth remedy that you should think, of course, again a rare remedy, but normally we don't think of that remedy because there is fixity in our mind that whenever there is chill with fever only then take that remedy. But Eupatorium perf also has this symptom, coryza, respiratory tract involvement with continued fever. So of these 4 remedies, I think one should fit your case. Do take some symptoms of coryza. How is the coryza? When is the coryza? And how does the patient behave in that symptom? That is important. Okay, Wasim bhai? Yeah, thank you. I hope you can treat that case properly. So let us go forward. Yes. So I was telling you, if there are no questions. No, there are no questions. So, if there are no questions, I'll just again go back to my topic, which before that, see, I am now been appointed as a faculty for palliative oncology in Dr. Batra's academy. So, anything related to cancer and palliative cancer oncology, I am the faculty. So, if you are with Dr. Batra's courses, so if you are there, I'll be able to help you in oncology also. So going back again, now perspiration. Now see, I'll just tell you very simple symptoms how to take perspiration. Now when do we perspire? In fever. The patient comes to you, doctor, whenever I have fever, I have very cold perspiration. I get very chilly. Understand why the patient is telling you is feeling chill. That is because of perspiration. So whenever there is fever with perspiration, I don't know how many of you must have used this medicine, but lately I cured a case. The patient had fever with perspiration. I prescribed the patient Cuprum Ars. and he what the patient told me, sir, I gave the dose here, and by the time I reached my home, my child was 80% better. This is perspiration you get normally from fear also. The patient comes and tells, doctor, whenever I have fear, I have a lot of perspiration. You must think of veratrum alb. Otherwise, veratrum alb, this has symptoms of social position and blindness presented, truth tells the plain. But perspiration from fear, you must think about veratrum alb. Simple, I'm telling you, perspiration during cough. The patient comes and tells you, doctor, whenever I have cough, I have a lot of perspiration. Again, in this symptom, we have Varetramal. But one remedy, my dear friends, Drosera. I asked, whenever I'm teaching my fellow doctors with me, I ask the difference between Spongia and Drosera. Of course, they have all the symptoms in the books to differentiate, but when the patient is in front of us, when the patient is coughing in front of us and the cough is dry, we have the Spongia as if cutting through a saw and all, everything is there, but difficult to understand how to differentiate between Drosera and Spongia clinically. On paper, there are a lot of symptoms, and you're very happy learning Mater Medica. I hope I am right, and I hope I'm making sense to you. Okay, so let us go forward. So there's one question, interesting question. Sorry to interrupt. How to differentiate between Crataegus oxycanthus and Arjuna Q mental symptom wise? My dear friend, I have not used basically Arjuna Q for mental symptoms. I don't know. I have my few symptoms which I have been dealing with, but still not confirmed. Crataegus, I can tell you. Crataegus is a very, very interesting remedy. Every time I what do you call? Every time I have Crataegus, and I'm very happy because there are a lot of history behind Crataegus, But in Crataegus, remember one thing. A Crataegus patient, if the patient comes to you and says, Doctor Sahab, since I am having heart problems, I have been making a lot of mistakes in writing, reading, talking. This is the first entry point of Crataegus. Makes mistakes in heart disease, or you can say very irritable with heart disease, and that is Crataegus. 3 symptoms which I take for Crataegus mind symptom is irritability with heart disease, makes mistakes in heart disease, and third is sadness in heart disease. These all 3 symptoms are the trio of Crataegus mind which I take for prescription. Okay, Arjuna, I don't know what is written in the books, but whatever symptoms I take is the patient is very cautious, anxiously, because he feels that his father or mother or one of the relative had heart disease. So doctor, you please give me something, you add something in your medicine so that I do not suffer from heart disease. This is what I have seen in lots of patients of Arjuna in my clinical practice. I don't know what is written in books. Okay, I hope you understand. किसने पूछा था क्वेश्चन? Who has asked me the question? Dr. Abid. Yeah. In dengue fever, how to approach the case? It is all symptomatic, and I had a very interesting case where I prescribed the patient Gelsemium 10m. The patient could not walk. He could not walk, and the family was in so much stress. Gelsemium 10m, single dose in water, of course. Within 3 hours, the patient started walking. Symptomatic. Please suggest me. I will just first complete, Can hyperthyroid be cured? Yes, definitely. Jimmy, it is definitely curable. I think the fellow doctors who are working with me, they will answer it better because they have seen those cures, So let me differentiate. I was just telling you, Drosera and Spongia. One of the very important point in understanding Drosera is, in Drosera, please write down in your Mater Medica. In Drosera, there is perspiration during cough. It is not there in Spongia. A very important, one of the assistants, the doctors who are working with me, I think if she is listening, write down. This is very important. A Drosera patient has perspiration during cough. And if you find a patient dry cough, wiping in front of you, a lot of perspiration, in spite of the AC on, you can think about Drosera. Okay? I'll just complete this lot of questions. Ferrum metallicum 200 को per week 1 dose दे सकते हैं क्या? Yeah, you can give. Yes, why not? In dengue fever, please suggest medicine for cough after viral fever. There is a rubric you should go. Post-viral influenza cough. You can get the remedy. Perspiration a lot while eating. See, this is again, of course, if it is out of control, then take that symptom. But a lot of patients, lot of people have perspiration while eating. There are some remedies, when the body is in a stasis, when there is stasis, lack of oxygenation, then you have perspiration while eating. So you have a lot of carbons in this symptom, like carbo animalis, we have carbo veg, we have carbon sulf in this. Of course, we do have kali carb also, we have I think nitric acid also. Just I'll add one thing. Whenever the patient comes and tells you, whenever I eat food which is hot, which is warm, then only I perspire. Otherwise, I don't perspire. Then, my dear friends, think of sulfuric acid and phosphorus. Do think of sulfuric acid and phosphorus. Okay. Thyroid is curable, whether it is hypothyroid or hyperthyroid. I have lots and lots and lots of cases of hypothyroid cured and treated with homeopathy. Okay. Now let us go forward. If some questions have moved forward, please do write again, because there are, I cannot see on this screen. So one more symptom, of course, there is one. Somebody had asked me, viral suggest medicine for cough after viral fever. No, there are a lot of remedies. What remedy comes into mind? Cough, influenza after. A very important remedy is Sticta pulmonale. Very, very important, Sticta. Second, I think it is Bryonia. And third, I think you must think about Sanguinaria. These three remedy I remember: Sanguinaria, Bryonia, Sticta. Dr. Bari, it is three remedies. You can go and see. It is very important first to understand that whatever symptoms you are asking is there in the Mater Medica or there in the repertory. Then it becomes very easy for me to tell you, and then you can go in the repertory and see. I don't know the whole rubric and the whole Mater Medica of what is given, but these are the 3-4 symptoms which are very, very important. So let us go forward. Yeah, Wasim bhai, thank you. That's if you write thumbs up, so I know the question is answered properly and I no need to go in that again. So I was telling again about perspiration. So I hope you got some symptoms in relation to perspiration, perspiration, coughing from perspiration. Reverse also is true. Because of coughing, there is perspiration. I told you, because of coughing, there is perspiration. And perspiration with cold is something different. So there are both the rubrics. Please go and see in the repertory on the Mater Medica. So let us go forward. There is one question on my mobile. So make sure that you basically have question on your this only on the YouTube chat. I have problem of hyperhidrosis, sweaty palms always, because when I rejected from army medical, whereas doctor suggests me Botox, can homeopathy help and treat? First of all, whenever a patient comes to me or anybody asks me whether homeopathy can treat this or treat that, let me tell you one thing, that homeopathy can definitely treat because in homeopathy, if your dose is right, if your case taking is right, if your simile is right, it can definitely show you good results in cases which you never expected in your practice. Okay, so it is definitely treatable. Which is the best medicines for alopecia? Genetic alopecia. Do a good case taking, do a good repetization, take a good syphilitic symptom. I think that would be the medicine for alopecia. Otherwise, common medicines which we take, you must think about is syphilinum is there, kali sulf is there, phosphorus is there, vinca minor is there, mancinella is there, carbovage is there. These are the remedies you must think about. Syphilinum is definitely a chronic and remedy for hereditary alopecia also. You can treat that. Okay, so let us go forward. Today there were a lot of good questions and I tried to answer most of them. I hope you're understanding the concept which I'm telling you. Everybody, hello? I hope you're understanding that, because I'm very fast sometimes. So that difficult word. So perspiration, I hope you understood this is non-verbal communication. That's why I wanted to just tell something about, there are other non-verbal communications also. But this was a very important thing because whenever there is perspiration, it is seen. For example, a patient says, whenever I get very angry, whenever I shout and I have perspiration. So perspiration during rage. We have Cantharis, we have Belladonna, we have Stramonium. These are the remedies. So go home today and read perspiration. It is a very important non-verbal communication that you must take note of in your practice also. So my dear friends, it is already half an hour up, and thank you for joining me. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Until next Saturday, goodbye.